common cases I encountered included OUD follow-ups. This experience was incredibly valuable, giving me the confidence to pursue. I learned about this tele-rotation through USMLE Sardi, US. It provided a comprehensive view of primary care operations, how to communicate in a non-judgmental and polite way. Hey there, I'm Dr. Sahana Khanan, currently in my final year of medical school in India. Recently, I completed a 4-week internal medicine tele-rotation at a primary healthcare clinic in Michigan under the supervision of Dr. Sad, who is a physician associated with Beaumont Dearborn Hospital in Michigan. I learned about this tele-rotation through USMLE Sardi. Initially, I was very apprehensive about how it was going to go, but I had a remarkable experience throughout. The staff in the clinic were incredibly warm, friendly, and supportive, always willing to assist me whenever I had any issues. So each day, my routine began by logging into the EMR to review patient appointments and notes from previous days. Most days, I worked alongside an on-site intern, but occasionally I handled patients independently as well. I typically saw 6 to 7 patients per day, but fewer patients on Saturdays and other days that were slow, like just 3 or 4 patients during those days. My responsibilities included obtaining a patient history with the consent of the patient, of course, and conducting a thorough review of systems and referring to previous SOAP notes to get an idea about the patient's previous diagnoses, so that it be followed up during the current visit. When the provider arrived, I was required to present the case history, and we discussed treatment plans, including medication refills, prescriptions, lab orders, referrals, and when to follow up. So competence was largely assessed by the provider based on note-taking and active participation in drawing up a treatment plan. Dr. Sad was incredibly instrumental in helping me improve my note-taking and offered constructive feedback as well, wherever necessary. My shifts were in the morning from 8:30 a.m. to 12:30 p.m. EST, which was 4 hours every day, and it was 6 hours during the weekend. The most common cases I encountered included OUD follow-ups and weight loss management and chronic conditions like diabetes, hypertension, and hyperlipidemia, which required us to provide counsel to the patient regarding diet and exercise regimen as well. Vitamin D deficiency was quite prevalent among the local population as well. So this experience was incredibly valuable, giving me the confidence to pursue further on-site rotations in the US. It provided a comprehensive view of primary care operations and my first exposure to an EMR system, contrasting with handwritten case sheets used in India. So interacting with patients from diverse backgrounds taught me how to communicate in a non-judgmental and polite way. I also learned to manage patient expectations, and sometimes I had to decline the patient request for their best interests, and also counsel them on various treatment options. Moreover, I gained insight into diagnosing conditions based on history and familiarized myself with commonly prescribed medications. Collaborating with fellow interns strengthened my teamwork skills and fostered a supportive environment for sharing ideas on note-taking and patient care strategies. So on the whole, I think this tele-rotation has prepared me well for my career as a practitioner in the future. In the US. So I'm grateful for this opportunity. Thank you.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.